Alarplasty preoperative care. In the past, I've talked about alarplasty, also alarplasty post-op care after the surgery, but there is some pre-op care that has to be done as well. Alarplasty is very common in people who have big nostrils and more common in the African Americans. And what I've noticed is that the sebaceous skin is more common in those noses as well. Sebaceous glands are the ones that make acne and pimples, and they have a lot of sebum production. So those glands can harbor a lot of bacteria. So when you do this surgery, you're at a higher risk of infection just because there's a lot of sebum production. If you take care of that in advance, then you're less likely to have that problem. So even coming towards getting close to your surgery for alarplasty, you have to take certain steps. And those include exfoliation and proper care of the skin in the area of the nose and especially along the grooves. And for that, what you need is just your regular soap that you use, moisturizing soap such as like Dove to wash the face, and then an exfoliant to scrub and exfoliate that area. Wash your hands before you do that. Wash your face with the soap and then use a scrub for at least 2 minutes to scrub all that area every day in advance of your surgery. The scrub that we like is called Gentle Exfoliant. I'll show you that. Gentle Exfoliant by a company called PCA. And we have it available in the office. You can get it, I think, online as well. And if not, just get any other kind of gentle exfoliant by any company and scrub that area. And as you scrub that area, it'll exfoliate, clean it, and then apply a very gentle moisturizer in that area as well. Not something very oily, such as Vaseline or Aquaphor or vitamin A and D ointment. No, not those. Maybe Aveeno or CeraVe, one of those very, very gentle ones, or any moisturizer that's used for babies. Apply that afterwards. So wash with soap, scrub with the exfoliant, then apply a very gentle moisturizer and do it at least a day every day before going to bed in preparation of your alarplasty, and wash your hands before the prep, and you will see that it'll really help. No nose touching, no nose picking. That's a complete no-no, because it sounds silly, but trust me, all it takes is just a little finger in there and you come in with an infection, and that can ruin your results. So be very careful. You have to scratch your nose. Do it the way I do. How do I do it? That's how. This is less likely to be dirty than your fingertips. Preferably grab a Kleenex and touch it. I'll see you soon. Take care.